name is Sue Croft and I'm a pelvic health physiotherapist at Highgate Hill in Brisbane. And we at our practice treat patients who have urinary and fecal incontinence, frequency, urgency, prolapse conditions and other pelvic pain issues. We see women, men and children for these problems. Now, this can be life-changing. When women and men and children are suffering with bladder or bowel issues, it is something that really impacts your life. It can affect your ability to socialise, to work, and to even have a happy, successful life. So with this intervention by a pelvic health physiotherapist, we can just use simple education to actually transform what is happening for you in this area. When COVID hit in March this year, where we closed our practice to face-to-face patients from March the 25th, I very quickly pivoted to telehealth because I was certainly wanting to keep offering something for my patients, but also I have 10 staff that I need to keep employed. And when we changed to telehealth, we found it was fantastically successful in terms of giving the information in a format that the patient could follow, even though they were thousands of miles away sometimes. And then if it was possible, they would come to Brisbane perhaps for another reason or a holiday or catch up with family, and we were able to then do that internal examination. But at that time when we first pivoted to telehealth, and I was concerned about my staff, I applied for a small business grant from the Queensland government, and this grant was worth $10,000, and in August we heard that we were successful. And I applied on the basis that I wanted to try and extend the reach of telehealth to rural and regional Queensland and to Indigenous women who may be having issues. So what I thought initially was going to be something to help my private practice, I really have a bigger vision now that I'd really like to try and see if we could make this telehealth work more in pelvic health for women out in rural regional Queensland. 1 in 3 women in Australia, the figures are, that suffer with urinary incontinence. If you've had a vaginal delivery, 50% of women over the age of 50 will have some degree of prolapse. Only maybe 15% of those women will be symptomatic, but certainly they may have some heaviness or drag, and it may impact their ability to exercise. Now, if those are the figures for Australia, then that means that these are the figures for rural and regional Queensland. They may even be higher because sometimes rural women are performing really heavy duties. If they're working on farms, then they're lifting heavy hay bales and they're helping with heavy jobs out there, they may in fact suffer worse symptoms of prolapse. Pelvic pain is something which is really under-recognised, and I don't know that many people feel or believe or understand that physiotherapists are actually fundamental in terms of the first point of call in managing pelvic pain. We have an increasing epidemic of using opioids to manage persistent pain, and what we know is that good pain science delivered in a format of education can improve the pain. 1 in 4 women will get a 50% improvement in their pelvic pain simply by good science, pain science education. So what we're trying to do is establish a routine where regional rural women can contact us, and we do a telehealth appointment with them, delivering the education. And then we've got to try and link in with physiotherapists who might be closer than coming to Brisbane, so that they can have perhaps that important and necessary internal examination from a physiotherapist who is closer to where the women are living. So if you would like to access a telehealth appointment, you can ring my rooms on 0407 659 357. You can contact my website via email on www.sucroftphysiotherapist.com.au, and send us an email. You can even book online, and these appointments are all conducted by women's health physiotherapists, pelvic health physiotherapists, and you will find the format very helpful. We also delivered video formats to allow the opportunity for you to see the pelvic stretches that we do, to understand some of the urge control strategies, because it's very hard to deliver that successfully through the computer. But if we send you the links afterwards, you can certainly find this very helpful. So I look forward to making contact with you, and also the physiotherapists who may be able to then see you in a region much closer than necessarily coming to Brisbane. Of course, if you ever are coming to Brisbane, we would love to see you in the rooms, but I see it as an opportunity to start delivering better outcomes to women who are a long way away from a big centre. So give us a ring, and I look forward to chatting to you at some stage. Thank you.